The March of Dimes is celebrating its 85th birthday this year.
And here to talk about all the work that's been done for local moms and babies over the years, Emily Kittell, Dr. Nathan Lepp from UW Health as well. First off, thank you so much for joining us. Emily, we'll start with you. We've all kind of heard the name March of Dimes, but people might not understand what it is you do. What is it?
Well, just like you said, March of Dimes' mission is healthy moms and strong babies. We work not only in the state of Wisconsin to do that, but also across the entire United States.
And Emily, this is a milestone year for the March of Dimes. Do you have anything planned to mark it?
Well, March of Dimes is celebrating its 85th year in existence. It started off by President Roosevelt and to combat polio, which March of Dimes was able to do by the 80s, and now we're focusing on prematurity. We have lots of events. Please check out our website, marchofdimes.org, to look for local and national events for the celebration.
And Doctor, obviously the maternal mortality rates in the U.S., they're not great numbers, are they? What is happening in that area?
Yeah, we're pretty abysmal. I mean, compared to other high-income countries, we are way above all of our peers. And it just keeps getting worse. While other countries are getting better, we actually have gotten worse over the last several years. Due to a lot of factors, includes the COVID epidemic that hit those already at risk even harder, kind of our fractured healthcare system, insurance system, the disparities we see. So all that is really adding up to increasing maternal mortality and morbidity.
I know the Wisconsin Maternal Mortality and Review Board found 97% of all maternal death in the state is preventable. What do we need to be doing to protect our moms?
Yeah, so we really need to be helping support our moms in their pregnancy journey, both before birth, during birth, and after birth, to ensure that they're healthy during that whole process. We need to make sure they're getting the care they need, the care that really they deserve, and taking care of themselves as well. Because when you're trying to choose between taking care of yourself, your child, work, there's all these competing interests. And we really need to be, as a community, as a state, as a nation, supporting moms in their pregnancy journeys.
Emily, how is March of Dimes invested in that whole process right there?
We do it threefold. We're really big in maternal and infant research, and we spend a lot of money on our 9 national research laboratories that work on figuring out what to do for maternal death, infant death, and prematurity. We also do a lot of advocacy work, so we work on national and state policies to advance the health of moms and babies. We actually work with the Maternal Mortality Review Board and also the Fetal and Infant Mortality Review Board and advocate for their recommendations.
Emily, for people watching this interview who need resources or want to volunteer, how can they get involved with March of Dimes?
Really easy, marchofdimes.org. You can put in the search bar Wisconsin. It shows you what our events are. It shows you ways to volunteer for those events, and then volunteer for any of our advocacy work or any of our mission opportunities here in the state of Wisconsin.
Well, you have such a great organization, such a great mission. We want to thank you so much for the time here today, both of you.
Thank you.
Thank you for having us.